to the third UKPHR Innovation in Public Health Awards. We're really delighted to be able to celebrate with you, even though virtually, the achievements of so many wonderful projects up and down the country in what's been the most demanding and difficult of years, where public health professionals such as you have been absolutely in the front line. And I know how very difficult it's been for all of you, and I just want to express my appreciation on behalf of everybody at UKPHR for all the work that you've done. Many of this year's entries for the awards include a description of the way that projects have found creative ways to continue to reach people who are even more isolated or lonely or anxious as a result of the pandemic. And I look forward very much to hearing more details about each of those projects. I also want to say a thank you to our supporters, Public Health Scotland, the Health Foundation, and Health Education England. And I look forward to spending the rest of the conference listening to these great projects that we're about to hear. Our first award of the day is the award for collaborative working, sponsored by Public Health Scotland.
Hello, my name is Vicky Bibby. I'm a director at Public Health Scotland, and I'm absolutely delighted to be here to introduce the shortlisted projects for the award for collaborative working. The three shortlisted projects are facilitating primary care to audit and identify early detection of cancer in Lothian, Melissa Clements, Policy Officer, COVID-19 Surveillance in the Scottish Government. The Caring for Young People Group, Sam Campbell, Health Improvement Lead, NHS Highland, Argyll and Bute, Health and Social Care Partnership. And Cut COVID Social Media Campaign, Sophie Wielden, Child Health Programme Manager, Medway Public Health. Let's hear more about these three fantastic projects.
Hi, I'm Melissa. As a primary care facilitator for Cancer Research UK, I collaborated with GPs and primary care teams to embed training and processes which enabled the early detection of cancer. My role in this project was to communicate the benefits of and secure uptake of the National Cancer Diagnosis Audit, which aims to identify blockages in cancer diagnosis. I did this through building relationships with key stakeholders by clearly communicating the expectations and benefits of undertaking the audit. In recognition of poorer outcomes among deprived communities, I secured funding for 10 GP practices within these settings to undertake the audit in addition to quality improvement projects. These quality improvement initiatives directly challenge barriers to early identification, such as making cancer screening more accessible and meaningful for communities at risk. One such local initiative, with targeted invites for bowel screening, including easy read instructions and a video, seen participation increase by around 25%. My role in establishing and maintaining contact with practice visits and facilitating learning and planning contributed to the collaboration and success of this work.
The Caring for People project brought partners from the NHS, Council, Third Sector and members of the public together to support people to stay at home safely during the first national lockdown in March 2020. We worked collaboratively with partners across agencies to deliver food, medicines, access to money and wellbeing support, utilising an assets-based approach. This enabled us to provide the support communities needed to protect their own health. We utilised existing structures and the desire to find a local solution in our remote and rural communities to ensure people could stay at home. An emotional support service was established to help those vulnerable to loneliness and prevent mental health referrals. And a variety of accessible information resources was co-produced in an effort to ensure no one was left behind. Empowering communities and supporting them to deliver a local solution was the most effective approach to meet the needs of people and improve health outcomes. Thank you to everyone who was part of this epic endeavour.
Hi, I'm Sophie Wilden. I work for Medway Public Health as a Child Health Programme Manager, and I would like to tell you a little bit about our recent social media campaign for young people. So following our lockdown survey for young people, it was clear to us that young people in Medway and beyond were really struggling to understand the ever-changing government guidance for COVID-19 restrictions. That led to Medway Council and Medway Public Health looking for a new and exciting way to frame key messages for children and young people. We needed to make sure it was engaging and relevant. This led to us working with Nail Design Solutions and Medway Young People to create our exciting and engaging Cut COVID campaign. We're really proud of the campaign. It's enabled us to reach audiences that we wouldn't normally reach through usual channels. It's been spread across TikTok, Twitter, Facebook and Instagram. It's had a reach of over 400,000 with over 1 million impressions. We're so proud of the campaign, and we're so proud that we've been able to support young people through this difficult time, ensuring they understand the key messages.
And now for the winner. The judges were absolutely impressed with how this project embraced new and creative ways of framing the evolving COVID-19 guidance that appealed to and engaged children and young people. I'm delighted to say the winner is Cut COVID Social Media Campaign. Huge congratulations, Sophie.
I'm delighted to be accepting this award on behalf of Medway Public Health and Nail Design Solutions. Massive thank you to James Harmon, who is the brains behind the project, and also a massive thank you to Antonia and Andy and all at Nail, whose creative expertise made this project possible. It's been absolutely wonderful to be part of such an exciting project. Thank you to all at UKPHR who voted for us. Thanks.
And now to the award for contribution to public health registration.
Hi there, my name's Steve Madden. I'm a UKPHR board member and I'm also the Director of Public Health at Swindon Borough Council down in the southwest. I'm delighted to be able to introduce the nominees for the award contribution to public health registration and also to be able to announce the winner. This today allows me to fulfill my ambition to be involved in an award ceremony, although I did think it was going to be the Eurovision Song Contest. So here are the results of the Swindon jury. Okay, the shortlisted projects are recognition for 11 years contribution as verifier to the Welsh Practitioner Scheme and champion of the public health practitioner registration and professional development. Maria Morgan, Senior Lecturer in Dental Public Health at Cardiff School of Dentistry and Honorary Public Health Specialist with Public Health Wales. The second nominee is Champs Public Health Collaborative, Lucille Scally, Public Health Practitioner Scheme Coordinator at Wirral County Council. Let's hear a bit more about them.
I have nominated Maria Morgan for the Contribution to Public Health Registration Award to pay special recognition to her. Maria is retiring this year, but has been a champion of practitioner registration since it began and has demonstrated an ongoing commitment to quality assurance and the value placed on professional registration.
Hello. I became a generalist specialist in 2007, supported by the Professional and Organisational Development Team at Public Health Wales. So when they set up the practitioner pilot, I was keen to contribute and I became a verifier from 2010. From very early on, I wanted to champion the fact that public health is a multidisciplinary workforce, helping to solve multifaceted problems, reflecting the formal definition of public health, that is, the science and art aspects. There's so much talent contributing to public health which has not been recognised, and the practitioner scheme is fundamental to ratifying this talent and providing personnel with career-enhancing certification. Whilst I am grateful to be nominated for an award, I feel that I have gained a great deal already by being a part of this process. It has been humbling and rewarding to witness the breadth, depth and creativity of public health service across the Principality. The future is bright and safe in multidisciplinary hands. Thank you.
Good morning, my name's Lucia Scally and I'm part of the Cheshire and Merseyside Public Health Collaborative known as CHAMPS, who host the North West Public Health Practitioner Scheme. I commenced as Scheme Coordinator in September 2018 with the task of designing the delivery of the North West Scheme. Our first cohort commenced in May 2019 and we offered a range of support to those practitioners, which included sub-regional support group sessions, whole cohort sessions and individual one-to-one sessions with the addition of Faculty of Public Health masterclasses and a commentary writing masterclass. And that was designed to facilitate the support that each practitioner could offer each other, as well as recognising that each practitioner's journey is unique and they need individual support at times as well. We've now got an established successful practitioner registration scheme. We have 7 practitioners who are registered currently, 5 of whom achieved that registration status in less than 18 months. We've gone on to develop and design a virtual scheme delivery offer, which means we will have 3 intakes a year, and those practitioners have access to an online community as well, so they can support each other through their practitioner journey.
I am delighted to be able to announce the winner. So the winner impressed with determination and ability to carry out duties throughout the pandemic, as well as providing unwavering support and encouragement to all around her. The winner for this award for contribution to public health registration is Lucille Scally, Wirral County Council. A huge congratulations, well done.
Thank you for this award and recognising how the North West has designed and developed and delivered its scheme. Being able to be instrumental in this work, along with system partners and the steering group for the scheme, with the support of UKPHR and also the shared wisdom of experienced scheme coordinators, has been very special. Being able to shape the scheme and be part of those individual practitioner journeys has been a real privilege as they've gained registration status.
Next is the award for Improving Public Health Practice, sponsored by the Health Foundation.
Jo Bibby and I'm from the Health Foundation, and I'm here to introduce the shortlisted projects for the award category Improving Public Health Practice. There were 3 shortlisted projects. They were Doncaster's approach to improve population health locally, the Vale of Glamorgan's Healthy and Sustainable Preschool Scheme, and a COVID response to ensuring hepatitis C provision in Hampshire continued and enhanced through the pandemic. So let's hear more about them.
Hi, my name's Karen Horrocks and I work in public health at Doncaster Council. I was part of the first cohort for the Yorkshire and Humber Practitioner Programme. I wanted to talk about my project today, which is about addressing the wider determinants of health by building partnerships and influencing policy and strategy. So what are the most important things to do if you want to influence people, policy and practice? First thing is to provide guidance, support and health. For example, if a policy is being created, make sure you get involved and contribute something. That's the best way to influence what happens within it. Build positive relationships. You want people to smile or feel positive when they think about you, and then they'll call upon you the next time. Developing others is really, really important. So as you find new tools and new knowledge, make sure you share them, train and develop others wherever possible, and create a network of allies and influencers. One of the things I'm proudest of is our graduate management trainees who come with us for a short period as part of their progress in the council. We tell them all about public health principles and practice, and they move on to their next placement and spread the word. And if we're lucky, they become the leaders of the future, or perhaps they come back and join us in public health. Most important is to be helpful and non-judgmental, have positive conversations, and it is important to build your case with evidence, but also it's important to show compassion and understanding as well. I think one of the most important things I've learned over the year is how important our partnerships and our allies are, and that's something that I want to see us build and develop into the future.
Hello, my name is Catherine Perry and I work as a Senior Health Promotion Specialist at Cardiff and Vale Public Health Team in South Wales. I work in partnership to coordinate the Vale of Glamorgan Healthy and Sustainable Preschool Scheme. It aims to improve the health of preschool-aged children by working through the childcare settings they attend, such as nurseries, childminders and playgroups. The project we ran involved offering resources and training opportunities to all childcare settings involved in the scheme, then inviting these settings to apply for a grant to more specifically target their work to the needs of the children in their care. Outcomes included enabling 400 children to benefit from additional experiences to improve their health, and the impact of these will be evaluated in 3 months. Some of the key messages are that childhood experiences have a lifelong impact, so let's really make them as healthy as we possibly can. Every moment counts. Some children are only in childcare for a very short time, so we need to try out ideas. If they don't work, refine them. Thank you for listening. Diolch yn fawr.
Hi, I'm Alina from Hampshire County Council, and today we are going to tell you about how we have used the mobile vans in Hampshire through the Substance Misuse Treatment Service to increase access to hepatitis C testing and treatment, to reduce health inequalities for those most marginalised groups in society.
Hi, I'm Alan. I work for Inclusion. During the COVID-19 pandemic, we've tested 72 service users, 23 of which have been referred onto treatment for hepatitis C. A number of these clients are people we would not have been able to engage without the provision of the clinical bus. Without the use of this clinical bus, this amazing work would not have been possible.
Hi, I'm Louise and I work for the NHS Addictions Provider Alliance on the Hep See You Later project, and just wanted to round off by telling you that due to the phenomenal success of this project, we've been successful in securing an NHS England award from the Hep C elimination monies to extend the van provision across Dorset, Hampshire and the Isle of Wight. So the van will soon be going out 4 to 5 days a week and will reach more and more people that are not ever been tested for Hep C and not known to services. Thank you.
First to say, the judges were impressed by the strong partnership of organisations that ensured that those at risk of additional disadvantage during the pandemic were supported. And the winner is the Vale of Glamorgan Healthy and Sustainable Preschool Scheme. So congratulations.
Hi, I'm Catherine Perry, Senior Health Promotion Specialist at Cardiff and Vale Public Health Team. I'm delighted to accept this award today on behalf of everybody who has contributed to the Vale of Glamorgan Healthy and Sustainable Preschool Scheme, especially all our partners and childcare settings. I'd also like to thank those who work so hard to promote practitioner registration across the UK. Thank you very much. Diolch yn fawr.
Our final award of the day is the award for translating evidence into practice, the Allison Thorpe Award.
Hello, my name's Helen King and I'm a board member at UKPHR. I'm here to introduce the award for translating evidence into practice, the Allison Thorpe Award. Unlike previous categories, we decided not to have a shortlist this year and have instead chosen one winner. I'm absolutely delighted to announce that the winner of this award is Louise Hanford, Hepatitis C Elimination Coordinator, the Inclusion Section at the Midlands Partnership NHS Foundation Trust. Congratulations to you, Louise. Louise is at the forefront of a project offering a revolutionary, multidisciplinary community approach to hepatitis C care in Andover, one of the most rural and deprived areas of Hampshire. But let's hear more about this project from Louise herself.
Hi, I'm Louise and I work for the NHS Addictions Provider Alliance on our Hep See You Later project. I'm here today just to give you a brief overview of what we've achieved in Andover, where we've micro-eliminated hepatitis C from the service. So basically, a couple of years ago, we recognised that the clients in Andover were disadvantaged due to transport links and other various health inequalities. So we secured funding to bring the hepatitis C service over into the community. We've been really successful, and during the lifetime of the project we've tested over 100 people and we've treated around 45. The service was initially quite resistant to doing bloodborne virus testing, seeing as it was a nurse-led initiative. However, through robust training, peer support and through showing them the benefits, the whole team got on board, and it was really exciting to watch. And we presented a poster at one of the conferences that had one left to treat, and the person that was the one left to treat, when they saw that was all they needed to actually come and get treated. So we are really excited to be nominated in this category. Danny Hames, who heads up the Addictions Provider Alliance, sees this as one of our flagship services, and to win this award would just be amazing. Thank you. I'm really excited to have won this award, and I really see it as a community effort to what we've achieved in Andover. It's really been a highlight of my career to see a service that really had so many unmet needs come to the point where we've eliminated Hep C. So thank you very much.
That's the end of our awards here today. Congratulations to all of our winners and finalists, and thank you once again for all our supporters and for you particularly for joining us today. The ceremony is going to be available on the website for you to share with friends and colleagues if you want, and I just want to wish you luck for the remainder of the year with all the struggles and difficulties that you'll be dealing with in your workplace, and I wish you well and health too. Thank you.